Hello, welcome to our week's discussion for types of health information systems. From our discussion last week, we know that nursing information is a system part of a bigger system called health information system. Nursing information systems deals with the aspects of nursing, hence the word nursing information system. Nursing information systems deals particularly in the maintenance of nursing records, according to Liascos and Mantas 2012. And today, we will discuss about a bigger concept, the health information system. The goal for this week's topics is for you to know the concepts of health information system, how it works, and their categories so you'll have a clearer understanding on the systems that influences the delivery of healthcare to the public. So what is health information system? The United Nations define health information system as a system that integrates data collection, processing, reporting, and the use of information necessary to improving health service effective and efficiency through better management at all levels of health services. In other definition, HIS is a broad term used when you refer to an electronic system that is designed to manage healthcare data. So, what are the health information or data that organizations collect? According to McGonigal and Maestrian 2021, providers collect demographic information like name of the patient, his whereabouts, and contact info. Another data that providers collect is diagnostic tests, insurance information, and other data and information that pertains to the patient. Collecting this data is essential so that providers can properly provide medical care or assistance that the patient requires that leads to a better patient care. As you can observe, that healthcare institutions more than ever are now adapting to the latest technology and trying hard to transform the way organizations manage their information, according to Shustri 2021. Organization uses different types of health information systems to collect, store, manage, and transmit patient information across organization. Today, I will be discussing about the different types of HIS and will try to explain the function of each. These are the key terms that you need to know before proceeding to our discussion today. These are just four, and I think there's a lot of them. First is health information system, EMR, and silos. According to Shusti 2021, there are different categories of HIS, and most of them share the same functionalities. Our discussion for today will walk you through 8 different types of HIS as identified by Shusti 2021. Some of these will be discussed in depth in the incoming presentation. The first on our list is a medical practice management system. This is a very important component of the healthcare system because it deals with documents, scheduling appointments, and other clerical works, which makes the facility run smoothly. Generally, this system does not include patient medical data because unit coordinators, assistants, or the clerks doesn't need to know the patient's medical information, but it processes insurance automatically, billing, and generates report. Benefits of using this software is automation of routine clerical tasks and easy access of healthcare data because you have to call medical records. Because before, I used to be a clerk and we used to call the health records to fax the patient's chart, but using this system, you don't have to because it's already in the software. This is an example of this is the GUI or the graphic user interface of eClinical Work software, an example of medical practice management system. So as you can see in here, you'll see the picture and the billing of the patient. The next that I would like to discuss is the electronic health records or EHR. I will discuss this system in detail in my later slides. EHR is also called EMR or electronic health records. So don't be confused when someone uses EHR or EMR. They are both the same. According to McGonigal and Maestrian 2021, EHR or EMR is a computer-based data warehouse or repository, meaning storage of information regarding the client's health status, which is replacing the former paper-based medical records. The world is transitioning to EHR or EMR because of its benefits. EHR is a systematized documentation of patients' health status and healthcare in a secure digital format which can be processed, stored, transmitted, and accessed all at the same time by the interdisciplinary team. The place where I work transitioned into full EHR in 2019. Canada is actually delayed in rolling out this kind of technology because of the several restrictions in standards that the Ministry of Health and the government is implementing. 10 years ago, when I was in the Philippines, we are using paper charting, and I just can't imagine what kind of documentation is used in the Philippines at the moment. So this is an example of an HR which is used in the place where I work. This is called the Epic systems. So in here, it is very interesting because this is the actual chart that we interface every day, that we as nurse interface every day. So you will see here the summary, and you will see all the um, summary of the patient, like the story, background, social history of the patient. And if you click chart review, you will be able to see laboratories, diagnostics, x-rays, and all the stuff, and notes as well. If you click work list, it will show you the things that needs to be done for this patient. And if you click MAR, um, the MAR there is the medication administration record. So it will show you all the medication and all that is scheduled for this time. The flow sheets, where this is where you can find the vital signs, your assessments tabs, your intake and output, and a lot more. Your TOA, your um, what else? A lot of stuff, dressings, wounds. Okay. Um, TOA. So TOA is transfer of accountability. In the Philippines, we call this endorsement. Like when they call it endorsement when we go to the bedside and do endorsement. In other countries like Canada and the United States, you call it TOA, transfer of accountability. Next is notes. So this is where you write your progress notes, and this is where you can also read the notes from the interdisciplinary team. We have here education orders. So this is where the doctor enter their orders, or the nurses too. Didn't you know that in Canada, nurses can also enter their orders? So you can enter your order here, or the doctor's order, and you can retrieve them. And sometimes when you enter them, they're automated. So it's easy for you, like, especially when you enter medications, medication already had dosages. Next is the navigators. So if you click on the navigators, you will see the disposition of the patient, whether admitted or discharged, and also demographics of the patient. This is a very good system. Before we use the paper format, and it's not that intelligent as this one. Okay, so this is an example of an EHR. Next, the next system that we are going to discuss is the e-prescribing software. This is useful tech because it enables providers to generate prescriptions digitally according to Sustri 2021. So in Canada and the United States, prescription works differently. Unlike in the Philippines, when your doctor prescribes you with medication, they give it to you, they give the prescription to you, and you go to any of the pharmacy you wanted. And then after that, you can take the medication. In Canada and the US, it works the same thing, but it has several avenues on how to get the prescription. You could either get the printed prescription personally by yourself, or have it faxed to your pharmacy, and you can just go to your pharmacy and pick up the medication, or subscribe to an app that patients can request a prescription but I heard that in the Philippines they're starting to use electronic format too. I have a friend who is a doctor who uses Facebook Messenger to send prescriptions to her patients. Um, a pharmacy called CVS in the United States is compatible with this system. Patients must sign in or sign up for their portal, for their patient portal, and um, this patient portal I will discuss. I will show it to you later on. I will discuss it too, and I'll show it and I'll show it to you. So patients can sign up in their patient portal, and then can request a prescription that format, and this request will go to the e-processing software of the physician. During the peak of the pandemic, where doctors need to work at home, they use this prescribed electronic prescriptions to their patients. Obviously, an advantage of this is that it allows doctors to send prescriptions directly to pharmacies without the risk of losing, and it provides a quick and easy access to a patient's medication history in case pharmacist needs to do a medical reconciliation. So, a medical reconciliation is when the doctor or the pharmacist streamlines the medications that are taken at home and the medications that are prescribed in the hospital. Now, what else? The goal of medication reconciliation is to arrive with a unified and clear MAR or medication administration record for the patient. So it's easy for the nurses and it's easy for the doctor to track the medications the patients are taking as well. So this is an example of an e-prescribing software. So our Copia is the GUI, the graphic user interface of Doctors First, an electronic prescribing software. The next system that I will discuss is the remote patient monitoring system. By the term itself, you will understand that this is used to monitor patients wherever they are, virtually around the globe. With the advent of technology, according to Shushri to 2021, the healthcare are considering AR technologies to make the monitoring very clear. As you can see, AR has revolutionized the way we operate the world. Facebook has transitioned into Meta, an AR-based social media. As you can, they changed the way we operate the world and has transformed the workflow forever. So the advantage of using remote patient monitoring are the following. It reduces the cost of the disease and assists in after discharge follow-up, helps monitor patients' blood sugar level or BP from anywhere across the globe, resulting in improved patient care. And the next slide that I'll be showing to you is a YouTube video from Medtronic Cardiac, which is an example of this system.
The following is an instructional video for patients with Medtronic implanted cardiac devices who use the MyCareLink patient monitor for remote transmissions. Elegantly designed. MyCareLink patient monitor for remote cardiac device transmissions. It's convenient.
So if you remember, we also talk about this one in the Internet of Things. This one is a cardiac monitoring, and the pacemaker is implanted in the patient's heart, of course. And we have this one, the what do you call this? The one that looks like a cell phone. It could also, there's a new model that uses a cell phone as well.
With global cellular technology, MyCareLink patient monitor. It's easy to use. First, open the box. The MyCareLink patient monitor comes with simple step-by-step instructions.
Now, it is very important that patient reads the entire manual for this. Usually, when we buy stuffs, we like throw the instructions out. For medical components or medical hardware, you need to keep the instructions with you. So sometimes when these things are broken or when it malfunctions, you can always refer to the manual. The only downside of this monitoring system is that this one is not battery operated. You have to plug it in. But the newer versions, as I've said, is a cell phone now. Let's continue to watch.
Set up and plug in. 10 feet from where you sleep. Now, you're ready to transmit. Remember to do transmissions as directed by your doctor or clinician. To begin, push the Accept button. You don't need a cell phone, but you do need a cellular signal. The easy-to-use display provides step-by-step instructions, walking you through the device interrogation and data transmission process. Place the reader over your Medtronic implanted device. The green bar means it's reading. If you see a reader placement alert during the reading, reposition the reader over your device until the device is located. The interrogation will continue where it left off.
Now, the reader needs to be plugged in, as I mentioned, and that's the downside of this model. Let's continue to watch.
Once the reading is complete, place the reader back on the base station. The MyCareLink patient monitor will now send your information to the CareLink network, where your doctor or clinic can access the data. Again, a green bar will appear while the data is being sent. A check mark will appear when the process is complete. It's that easy. The sleek new design of the MyCareLink patient monitor is lightweight and portable, making it easy for travel. The global cellular technology will work in most countries if a cellular phone signal is available. Just remember to keep your monitor plugged in.
So the downside of this kind of technology is that it's expensive too. Can you imagine if you go somewhere around the globe, you need to have an international data plan. So this one can transmit, the transponder can transmit information back to your doctor's office. So that's the downside of this. But the advantage is that the doctors can monitor you. So these are the systems that are now being used in healthcare to monitor patients properly. So this is what we call the remote patient monitoring. The next one is the next system that I will discuss is the Master Patient Index, or MPI. So MPI is a critical component of the hospital management system because its goals is to link patients' records from multiple databases. So according to Shusti, this is used by clinics or large hospital whereby they enter the data on their patients. Once the data is entered, it is stored and can be used for future references by any organization sharing the databases. The system, or MPI, created an index of all encounters. So when you say encounters, that means to say the time when patient went to the hospital, or records of a patient, which can be accessed by all units and all departments. So in short, MPI gathers all the patient information, including the encounters, and index it. According to Shusti 2021, the main use of MPI is the prevention of inaccuracy of information that has a devastating patient outcomes and prevent duplication as well. MPI is a very specific system. For example, an X-ray was done to you and your name is Domino Pusan, and the diagnostics department recorded it under Dominic Pusan. When they pull you, when the doctor pulls up the X-ray image under Domino Pusan, that information is not there because it is under Dominic Pusan. We have encountered this kind of problem, and we have to contact the IT services to fuse the same name as one. Another problem with the core is when women get married and change their name, or if a person has another name. So when you immigrate to Canada, when you migrate to Canada, what happens is that you have the option to change your name. I have one patient and she changed her name when she transferred to Canada. And then in the health record in the MPI, she has two names. So, and each names were filled with medical information. We have to call IT services to fuse both the name, and we have to, and when they fuse it, they have to confirm with with the patient herself in order to prevent um, deletion of important information. The next YouTube video will explain MPI, and this video is from Santi Sweets.
Today we'll be learning about Master Patient Index. You may have heard of Master Patient Index, or an MPI. But what is an MPI? To explain, let's use an example. This is Sarah. Sarah is pregnant. During the course of Sarah's pregnancy, she's going to interact with a lot of different applications used by her providers in the health system. She's going to need to go to antenatal care clinics, HIV and PMTCT clinics.
Okay, let's stop over here. So when Sarah goes to those clinics collects information and ask demographics from Sarah. So MPI prevents the duplication of those information. Let's continue.
And even immunization clinics. Each one of these functions are what we call healthcare verticals. These are typically broken along disease vectors or care paths. Each vertical typically has its own staff, its own software applications, and its own clinical data, which these software applications track. This data is then used to derive indicators and inform outcomes for that particular program vertical. Problem is, each vertical has its own series of software, data, and outcomes, and these are typically different from other verticals. So, if Sarah visits an antenatal care clinic, she might be given some sort of identifier for that particular program vertical. And later on, when she visits an HIV clinic, she is most likely going to get another ID for that.
So why do they put an ID in every visit or encounter for Sarah? Because that's how MPI works. Putting a number in there or a serial number prevents duplication. Okay, and that will be the reference of that visit as well.
That particular vertical. But imagine if we want to share Sarah's data, say for a report, between these healthcare verticals. From an integration perspective, the system receiving the aggregated data would have to ask the question, is this one patient or is it two? To solve this, we need a consistent way of identifying Sarah across systems. A national identifier is one such way we can accomplish this.
So this is when the data from the clinic or other organization is transferred to a national repository system. So the national repository system will have the MPI or the master patient index that can properly identify patient visit or patient encounter. In Canada, we use this one because a lot of organization needs to access your healthcare information, including your insurance company. So they need to access your information, especially when you ask for like an insurance, like a critical insurance or any other kinds of insurance. So now you will know that the government plays a very important role, big role actually, for health information systems.
If we gave Sarah a national health identifier, we could cross-reference her between systems.
So your national health identifier could either be your pag-ibig number Or I don't know, you guys have healthcare OHIP number in Canada, in Ontario, we have a card called OHIP card, health card. So our health card has a number, so it's similar to the National Health ID. So all our hospital visit, ER visit, admissions or whatever is connected to our OHIP number using the MPI system, the Master Patient Index System.
But how do we cross-reference these health identifiers with local program identifiers? The answer is a master patient index. So, let's say Sarah shows up for an antenatal care visit. Her physician would use their own software to enter Sarah's information. Inside the antenatal care software, it would still give Sarah a local antenatal care identifier. However, that software would now send her demographic information to a master patient index like the Medics CR. Here, the Medics CR would generate a unique identifier for Sarah and share it back with the antenatal care system for future.
Can you imagine if in the Philippines the Department of Health has this? Or I'm not really sure if the Department of Health has this. If they have this, then that would unify the health records or the patient index in the entire Philippines. And can you imagine how big the task is as well? So you need a lot of people that knows computer, and you need a lot of in IT personals to do this. IT personals who are not only IT but nurses, and you guys are in the big position to fill the gaps because we don't actually need like an IT who does not know nursing. We need an IT who knows nursing because we don't want to create a system that is alien, a system for nursing but alien to nursing.
Reference. It would also link Sarah's local identifier with this newly generated unique identifier for Sarah. Sarah could be given a card with this identifier to use in a future visit. Later on, when Sarah visits an HIV clinic, her physician would use that system to enter her visit information as they normally would. This time, her clinician would also include the unique identifier previously given to Sarah. Again, the clinician is using their own software, and it generates a local identifier for Sarah for that particular program vertical. The system would then send that information again to the master patient index. Here, it would cross-reference Sarah to an existing master patient index record. The MPI would then simply associate the new local ID for HIV care with the master record and share the status of Sarah's MPI record back to that local program vertical software. Now we have an MPI with one record for Sarah. That MPI record cross-references all of Sarah's local program identifiers with this master record. Using the MPI in this manner, we create a patient-centered digital health ecosystem rather than a disease-centric ecosystem. Using the Master Patient Index, we can reliably identify Sarah and her baby and make sure that they are cared for no matter where they seek care. For more information about the MPI or the Medics.
So that's all about MPI. So the next one that I'll be discussing is the patient portal. So now we'll talk about the patient portal which is another category of HIS. This system allows patients to access their patient information using smartphones, tablets, or computer. Patients can access all of their stored information in the EHR, for example, past medical history, treatments, encounters, and other medication previously taken, according to Shristi 2021. It also allows patients to request for an appointment schedule, pay and view bills using this app. Some patient portals like the CVS is a pharmacy in the United States, that will allow you to have a conversation with a nursing practitioner or a doctor or a healthcare professional so you don't have to wait in the queue. Let's take a look at my own personal record in CVS in their patient portal called my chart. So right now we are opening my chart in the patient portal of the CVS. You can either use your Face ID or log in to open the app. Now it opens my chart, so here you can see a lot of options. We have the dashboard that allows you some important info, and we click on the labs to show how the entire details of the lab results and when it's done and who is checking you at the time of visit. Next one is the visit. So you will see here policy and visiting information in terms, the terms and condition. There's also a locator of CVS and also the records. Next is the menu where you can find records of medication, questionnaires, tracking your health insurance summary, and share your records to other organizations or other hospitals or clinic. So this is the appointments. So we have the past appointments or encounters or the future one. Then we go to payment methods. You can always pay via credit card or your debit card. So when you click the D, the logo for D or stands for domino, it shows your account settings and to log out. You can also link this app on your Apple Watch. So when you visit, you just have to scan your Apple Watch and then it opens your entire patient records. The next category that we will discuss is urgent care applications. According to SURE-T 2021, it is a type of management information system that keeps track of patients that might require immediate attention. It allows the patient to skip the waiting room and get the care immediately. Also, it provides the clients with knowledge about other health-related inquiries, educational materials, and allows patients to track their medical care status. Advantages of implementing the systems, according to SHUSTI 2021, are following. Increases patient satisfaction because it provides a quick service. Because when you go to the patient's, you go to your family physician's office, you have to wait for 3 hours in order to get the care that you really wanted. This one provides you with immediate response and immediate knowledge. Now people like in this modern era, people needs instant feedback. This is what we call the microwave era. And also another advantage is that it provides patient with help 24/7. In this next video, an example of urgent care application is Health Tap. So this is the Health Tap experience. Let's watch this.
Back in the day, doctors made house calls. They were familiar faces, and they always had time to care for you. Unfortunately, those days are gone. Nowadays, it's sifting through pages and pages of articles, links, forms, and ads.
So we already discussed this in chapter 3 when we talk about the internet. A lot of people go to Google, and they are actually, if you search some like when you search something in Google, there's actually legit websites that will answer. It gives you information about your symptoms, and this is a more legit way. This is an app, a system, a more legit way. Okay.
Finding tons of information, but no real answers. Answers that should come from a doctor. But even after all the long lines, jam-packed waiting rooms, and mountains of paperwork, the 5 minutes you do get can leave you wondering. Hey, wouldn't it be great if you could have this without giving up any of this?
Yeah, that would be great if what you read is what the actual doctors would tell you. So if you go to the internet, you don't know what kind of literature that you're reading, if it's legit or not. But this one, it is a good system that is coming from legitimate sources and legitimate doctors as well.
Well, now you can with HealthTap. At HealthTap, we understand that when you need help, you want answers from real, knowledgeable people, which is why we provide something you can't get anywhere else: fast and free access to trusted and caring physicians. We've brought together some of the best doctors and healthcare specialists from across the country.
So another one advantage of this is that doctors they can work wherever they want. Um, I'm just concerned about because I think in the United States entire you can practice your medicine or your nursing everywhere, but nursing no, there are some states that does not. You have to apply for reciprocity before you can practice your nursing. I just don't know for doctors, but this platform provides doctors even provides doctors with an opportunity to practice their medicine across the country.
And we give you immediate access to this online network of amazing physicians at no cost. Ask questions and get real responses from real doctors with real expertise. Even get second and third opinions instantly as physicians rate, comment, and provide active peer review. And now we're making a whole new kind of conversation possible. For a fraction of the cost of a single copay, you can have a completely private, secure dialogue with a physician of your choice. You can also exchange messages, health records, test results, and even photos for a more informed professional opinion. With HealthTap, doctors are making house calls again, just like old times, but better. Connect with the best doctors today at HealthTap.
So that's HealthTap, an example of urgent care application. So the last one that we'll be talking about is medical billing software. So in the Philippines, I always remember this saying that forget everything, not the pay. In Filipino, kalimutan ang lahat, wag lang ang bayad. Our next topic is about medical billing software. The medical billing software or billing solution is the most integral part of the healthcare management system. Before I will proceed, I will explain Canadian healthcare system and the US as well. So in Canada, basic healthcare is publicly funded, like visit to the ER, admission to the hospital, labor delivery, cancer treatments, and many others. Each of the provinces has its own health insurance plan. In Ontario, we have the OHIP card or the Ontario Health Insurance Plan. Permanent residents and citizens are eligible for OHIP, which means when they are hospitalized, they don't have to pay for anything. So basically, all hospitals in Canada are funded by the government. So when a patient is hospitalized in Canada, the hospital charge the government or OHIP for the hospital fees. So as you can see in the diagram, it's the federal government that funds the healthcare of the people here in Canada. So in the United States, the US and the Philippines, I think, have an identical, more or less the same methods of funding their healthcare, both by private and public funding. So when a patient is hospitalized, either the patient pay out of pocket or through Medicare, Medicaid, or others from the government in which eligibility applies, or by private insurers. I think this is also true in the Philippines, wherein when you are hospitalized, the people share the burden of payment, hospital bills payment. This is important to know because when you apply the system for medical billing software, you know what the system does to either charge the government, the private insurers, or the person themselves, and in what percentage a patient pays in the hospital bill. In Canada, it becomes a complication when you are admitted in the hospital and you are not a permanent resident or a citizen because healthcare is expensive. That's why it is very important to have an insurance to cover your hospitalization before visiting Canada as a tourist. Going back to the medical billing software, this is one of the most time consuming and most critical according to Shrusti to 2021. The software makes it easy for the management because it automatically generates bills and managing the entire workflow. The software also processes insurance claims, verifications, tracking your payment, and processing. The system sends out alerts for non-payments or late payments or any pending from the hospital and in the hospital end. That's according to Shrishti 2021. And I guess we finished discussing the eight types or categories of hospital information system. And now we are to proceed with the next ones. These are the applications in health informatics in the academe, in clinical practice, and education. If you would like to go for a break, please go and be back here in 5 minutes. And you're welcome to pause this video. So we will continue our discussion. According to Shrishti 2021, that Health Information System, or HIS, is the future of healthcare centers, and despite that, many of the organizations are doubtful about adopting because it's expensive and lengthy implementation process. I remember when my workplace transitioned into the application of Epic in everything in the hospital. There were a lot of issues from nurses, not starting from nurses not comfortable with the system because it's difficult and complicated to dysfunctional equipment. Equipment doesn't work, doesn't connect to the internet, and sometimes they fail. So it will say connection fail, and that's so annoying. But as time went by, nurses and staff became adept to the system, and everything went smoothly. So we are now to talk about the application of healthcare informatics in three categories: clinical practice, administration, education. So we will talk about systems that are under these categories, okay? Now we will discuss the application of health informatics in clinical practice, a basic knowledge. The first one will be HR, or electronic health record. A basic knowledge of HR in nursing is now considered by many to be an entry-level nursing competency, according to McGonigal and Mistry in 2021. In Canada, if you continue your education here or you want to practice nursing here, NNAS will gonna check your transcript of records if they contain nursing informatics, because this one is highly encouraged in the nursing curriculum. AHR, or electronic health record, according to health.org 2019, is the digital version of a patient's chart. Others call it an e-chart. HR are real-time and patient-centered records that makes information available instantly and protected by levels of security that only authorized users can access. According to healthit.org 2029, no, not 2019, even if HR does not contain medical and treatment histories of patient, it is designed to go beyond standard clinical data that is gathered in the doctor's office or in the hospital. The authors mention that EHR is a vital part of health and can contain medical history, diagnosis, medications, treatment plan, vaccination dates, allergies, diagnostics, and laboratory data. HR also allows access to evidence-based tools like your protocol sliding scales that help a provider on clinical decisions. HR also makes provider workflows streamlined and automated. What that means is that the provider can schedule whether to put an order on a specific time or discontinue an order on a future time with expiration date, like your restraints. The restraints are good only for 24 hours. So if a doctor's order that, the system will gonna put an end to the order in 24 hours. So so the nurse has to call the doctor for a reorder. The provider can also put in an order to remind nurses on a task that needs to be done, like your daily weight. HR can be standalone, meaning a system for that organization only, or interoperable, meaning shared with other organizations. Advantages of using HR is that, number one, it increases delivery of guidelines-based care. So when you say guidelines-based, it is based on a policy or a protocol. It is not based on, remember you remember nursing? I mean, remember the process of um, nursing informatics, data, information, knowledge to wisdom. And I mentioned about, people having the wisdom. They don't share the wisdom, but now this wisdom is shared, and this wisdom is translated into a written form, which is a guideline or a policy. So your EHR increases the delivery of guidelines-based care. Next is enhanced capacity to perform surveillance and monitoring for disease conditions. Three, reduction in medication errors. That's one of the biggest advantage of using this system. And number four is to decrease use of care because because you don't have to repeat over and over again. Like for example, when you assess the patient, you don't have to ask the patient, do you have wounds? When you see that in the previous record the patient has wounds, what you need to do is to reassess or measure the wound if the wound is still there or is healing or it becomes more severe. A study in 2011 of the effects of EHR adoption on nurses' perceptions of quality of care, communication, and the patient safety documented that nurses reported better care outcomes and fewer concerns with care coordination and patient safety in hospitals with basic EHR. Disadvantage. One time I was asked by my colleague on what is the disadvantage of EHR. So one of the biggest advantages is financial issues because you can't buy the system. You have to subscribe it yearly. So I don't know how much money would it cost, but I believe it's very expensive. Changes in workflow. So your manual paper charting will be changed. So everybody, like all those old-time nurses, will be shocked, and of course, the administration will be shocked too because everything will be changed. And also, and people like consistency, and they love the things that they have done long time ago. But this one, when you introduce this one, there will be changes. Next is temporary loss of productivity associated with HR adoption because the problem with this is that when you apply this one, everything will slow down because all people will need to adjust, right? Privacy and security concerns too because it's online, so there is a higher tendency that hackers will get into the system or spam emails will be opened by your employees, and this will you know burn the entire system. So number five is several unintended consequences. So like resignation of nurses because they don't like the system. It happens. Okay. So standard terminology in EHR. So as we move forward towards an interoperable, so when you say interoperable, meaning this information can be shared with other systems or other organizations. So as we move forward towards an interoperable EHR, it becomes clear that we need standardized terminology. EHR must be formatted in a machine operable manner to support interoperable exchange of information and data mining. In order to standardize terminologies, we can use the North American Nursing Diagnosis Association, or NANDA, or Nursing Interventions Classifications, or NIC, or the Nursing Outcomes Classification, NOC, and many others. It is very important to understand that nursing terminologies interface that is being used in HR in order to describe patients, document care, and structured elements of the information system that nurses use. So we have to have a uniform terminology. So to better understand the graphic interface. By just reading it, we understand. So, for example, fever. So, fever is across the nursing field, fever is cold fever. If, for example, in your system you use hyperthermia, so write hyperthermia. So my suggestion is to write the simplest term that everybody understands, or use standards from NANDA, from NOC and NIC, because there is no single model of standards terminology for healthcare or nursing that can represent all the contributions of the health of a patient. Work is ongoing to map terminologies to one another. Ownership of the electronic health records. So these are the steps in the selection process, or in the or applying, or how to like implement a new system, or implement an EHR in your institution or organization. This is also how my workplace implemented the change. Number one is vendor selection process. In this step, it is important to survey the organization's interest. So you have to survey, ask everyone what they need, identify possible barriers to participation like age and education, and documents desired functions of the HR, what they really want. I was asked one time, what do you want in the new system? What I said is that, oh, I wanted to do my assessment using like a standardized assessment tool. So yeah, they take note of it and applied it in our AHR. And also, aside from desired function, uh, assess also the willingness to fund the implementation, because this is expensive, and everybody should be on board, including the administrations. And a heavy justification should be done in order to, get the necessary software that you want. Number two, choose a system based on the organization's current and predicted needs. In this phase, you will see demonstrations from vendors of HR products. One should compare each product features based on the completed needs assessment. So remember, you survey your people, right? What they need, what they want, and make sure when you choose in step two, when you choose the software, you choose based on the assessment needs, not based on under the table or cuts, you know, or any other else. Okay, based it on your assessment needs, a needs assessment. Number three, step three is implementation planning. Should go together with selection process, particularly the assessment of the scope of work, initial sequencing of the EHR components to be implemented, and resources required. Step four is end user adoption of EHR. In this step, the clinician should be engaged in the use of system to practice the workflow of the system. Both doctors and nurses should be engaged, right, in using it, should be passionate in using it, and inspiring others to use it as well. The most effective change management plan is to expose the users or the end users to the system so they will get used to it. Number five is training. Training can be delivered through learning, independent exercises, and peer-to-peer at the elbow support. In the hospital where I work, I remembered we did this in class session for the training and online exercise, as well as at the clinical area. We have like super users on standby to assist us on what to do. Sometimes you forget stuff, right? You ask them, and they're standing nearby to help you. Number six, implementation plan should account for the long-term optimization of the EHR. Optimization of these activities of the EHR should be considered a routine part of the organization's operations. So every day, your health educators would, encourage nurses to use this feature in the EHR, or to, like, for example, some people, for example, assessments. They write in this in the progress notes: alert oriented, patient received on bed, alert oriented, whatever. So health educators encourage clinicians to write it in the appropriate forms, like your flow sheet, basic assessment forms. So despite the challenges, the future of HR is very exciting for patients and clinicians, and I'm also thrilled about the development of this development of this technology. Next, still in clinical practice, we'll talk about telemedicine or e-medicine. Still, we are in the types of HIS. Under the clinical practice category, telemedicine is defined as according to e-visit as the exchange of medical information from one location to another using electronic communication, which improves patient health status. Advantage of using telemedicine is cost savings. Cost savings in the long run, not when you um, apply it, because you have to buy all the gadgets needed for this, not only the cell phone and computer, but also the hardware that can communicate to the computer. Remember the Internet of Things? Next is convenience. So you don't have to travel far if you're located in Canada. Canada is a very huge country. There are some areas that uses telemedicine because the doctor cannot reach the area. For example, the areas in the northern part in Saskatchewan, they use telemedicine there because the patient cannot travel, especially when they're older adults, right? Provide people with immobility limitations or far rural areas receive a boost. Telemedicine receive a boost during the COVID-19 pandemic, which found healthcare providers scrambling to provide safe access to care while maintaining quality and care continuity. Disadvantage of using telemedicine or e-medicine are the following: not for every type of visit remotely. So not for everything. Some visits should be done in the doctor's office in order for doctors to properly assess you. Security risk for personal health data is another disadvantage. Security risk, that's always your number one concern. And during the peak of the pandemic, we use this system, the telemedicine, and the doctor has to, when they start their consultation, the doctor has to open up that because this is online, there might be data breach that will happen. Hackers will be there, and if the patient agrees with that, and all the time patients they agree. So it is necessary because you don't know, this is the internet super highway, and along the way, hackers might interfere, might capture important information. Some insurance, another disadvantage is that some insurance do not fully cover, leading to out-of-pocket cost for telemedicine. So the next slide will be a video from YouTube, an example of telemedicine by Agnes Telemedicine. It will tell you how it works. And actually, almost all telemedicine platforms work this way. Let's watch this.
AMD Global Telemedicine has revolutionized the way medical care is being provided around the world with Agnes Interactive Telemedicine software. Agnes Interactive is web-based software.
So did you see those machines? So those machines, those were nurses on the other end, and on the other end are the doctors. So these machines are connected to the computer so doctors can visualize them. So nurses are trained on how to use these machines as well.
Used for clinical telemedicine exams and video consults. Its primary function and game-changing benefit is to aggregate medical device data and deliver it to remote specialists.
So otoscope should be connected to the internet too. Connected to the computer so doctors can see it on the other end. Nurses are trained, as I've said, trained on how to operate it, but they're not trained to interpret what is being seen.
In 100% real time. In a single workspace, the remote consultant can interact with the patient and on-site clinician as if it was an in-person examination. Here's how it works. The patient-side clinician logs into Agnes Interactive through the browser on the PC. An Agnes session is now initiated, and a virtual private cloud is created. awaiting other assigned users to join over the network. The remote consultant can now sign into the Agnes session using nothing but a PC with a web camera, an internet browser, and discrete login credentials. Once logged on, a real-time, secure HIPAA-encrypted telemedicine connection is established and the consult is ready to begin. During the consult, Agnes automatically aggregates all of the data coming from connected medical devices, such as heartbeat, blood pressure, medical images, video, etc. Through the use of Agnes Interactive, remote healthcare providers have real-time access to their patients. This includes HD video conferencing, remote PTZ cameral control, and live streaming of medical images, videos, documents, and other medical data such as ECG reports, X-rays, and patient consent forms.
So for countries like Canada who have areas where there's a lot of there's always winter, this is actually beneficial to those areas like in Saskatchewan and northern part of Canada. In the Philippines as well, where there's a lot of islands, this can also be beneficial. I believe that long time ago when I was in the Philippines, they are starting to implement this kind of technology. Me and my students were in a hospital in, where is that the hospital? I forgot. In Manila, where they do teleconferencing because doctors cannot go immediately to other branch, so they have to perform telemedicine.
The patient-side clinician now serves as the hands of the remote specialist with the ability to do a full examination on the patient. At the end of the telemedicine consult, all of the information collected and shared during the examination can be easily saved to your EMR or location of choice.
So if you will observe that all the systems, so before systems are created differently from each other, and now there is a movement to connect all the systems. So this one can also be connected to your EMR or your electronic health record, EHR.
Using our HL7-based EMR integration module. Agnes Interactive distinguishes itself from other telemedicine software in 3 very significant ways. Agnes delivers real-time, on-demand telemedicine in a virtual private cloud. Agnes requires no back-end servers and no additional software or hardware for the remote consultants. Agnes integrates with EMRs through an HL7-based EMR integration module. As telemedicine technology has been helping healthcare organizations around the world offer quality medical care to their patients in underserved or remote areas, Agnes Interactive is the tool they trust for a streamlined, secure, and reliable telemedicine experience.
That's all for telemedicine.
Contact
Our next discussion will be e-health. So e-health is defined as the use of information and communication technologies for health and include the use of email, text messaging, push notification, websites, and mobile-based applications. Advantage is that it reduces staff stress, efficient and accessible patient record, time saving, and keeps staff in their position and attracting them because this one like this makes our job easy, like when it's easy people are attracted to it. And the disadvantage is that um, changes communication process with the staff, and also training of staff is time consuming and lengthy process. So e-health delivery McGonigal, our my primary source, McGonigal and Maestrian, defined eHealth as the healthcare initiative and practice supported by electronic or digital media. The most typical use is for the patient and family education, whereby information is communicated electronically. Services that are thus provide include physical, psychological diagnosis and treatment, telepathology, vital signs monitoring, electronic prescribing, teleconsultation, and many others. And now we will talk about the application of health informatics in administration. So administration covers a very long area. Um, in this fast and ever-changing healthcare environment, institutions require quick, fast access to several types of information, data, and bodies of knowledge for everyday clinical, operational, financial, and operations in the human resources. Information simultaneously shared in different unit or wards and departments within healthcare organization is also required or requested from other healthcare organizations, regulatory and government agencies, academic and philanthropic institutions, and consumers, according to McGonigal and Masrian. To simply explain it, it means to say that a patient's file, or shall we say chart, may be used and shared with other nurses and doctors or being accessed by other units or wards. In Canada, the government or the Ministry of Health is given an access to data in the hospital so they can monitor and regulate the condition of the hospital. When it came to the United States, patients also has access to their own electronic health records. That means to say a patient can see his results or tests done via an app. Healthcare education needs a system that works in different units or different departments that are accessible for storage and retrieval. But according to McGonigal and Mistrian 2021, healthcare organizations are unique from other organizations that uses information systems. They quote Fishman et al., who identified 6 important elements of healthcare. That's why it's unique. Number one, the stakes are life and death. So this is not a game. This is not a thing that we can just cancel and then in dealing with healthcare is a serious matter. So that's why um, healthcare organizations we use IS in a more serious manner. Next is healthcare information is highly personal, so there is always a risk for data breach. Healthcare is highly influenced by regulation and competition, so there's a lot of regulation that regulates healthcare health information systems like your HIPAA or the Philippines Data Privacy Act and many more. Healthcare is professionally driven and hierarchical. So there are different levels of layers in healthcare. Healthcare is multidisciplinary. Healthcare information system implementation is complex and important for implications for learning and adaptation. Healthcare institutions adopt several of the clinical and administrative types of information system. So when we talk about application of health informatics in administration, it is very important to talk about interoperability in its principles. So interoperability is the sharing of information from one unit or department organization to another. So some of the information systems that have been in healthcare industry for quite some times, and unfortunately, some of these information systems or IS, also known as legacy systems, created data silos, meaning to say that data created on those systems remain in that system and not shared with other systems, according to McGonigal and Mistrian. As you can see in the picture, the silos represent the systems and all data and information they create is not shared. So in order to make interoperability possible, according to McGonigal and Mistrian, 2021, standards should be implemented, meaning they have to implement the same format or storage and use standards terminology. Remember when I say that you submit your assignment and follow the format, last name, and title of the assignment in naming your file? That's a standard. And in order to share this data and have the principle of interoperability, organization applies standard. In the US, there is a nationwide goal of implementing interoperability as well as in Canada too. And it has been a worldwide vision as well. There are four types of health information technology interoperability. So the Healthcare Information and Management System Society identified four types of information technology interoperability. Number one is foundational interoperability. It sets the requirement necessary between systems to communicate data. They should have the same or compatible systems requirement in order that their system is able to process the data or simply open the data in their end. For example, a patient is being discharged from hospital and sent back to the nursing home. So then you as the nurse generate an after visit summary, or we call it AVS, or discharge summary, in a PDF file and send it to the nursing home. The nursing home, on the other hand, was able to open and read the report, and the clerk was able to add the file into the patient's electronic record into the facility. So that's a foundational interoperability. Next is structural interoperability. Defines syntax or format to facilitate data exchange. To make it in simple terms, each system should agree. For example, if they are making a Word document, they should agree on one format. If they agree on the docx format, then it should be in docx format, not in PDF or any other format. In short, they should create standard format. The problem is when both systems generate information in different formats, so none of them can open the file. Using the same example I mentioned about a patient that is going to be discharged and sent to a nursing home, if both the hospital and the nursing home is using health level 7 standards for data exchange and collects certain minimum data, which make it possible for the nursing home system to automatically auto-populate some data fields. This is an example of structural interoperability. For example, the clinic asks for demographic data, and this clinic uses the same standard as with another clinic. So when that patient is transferred to another organization, those information being collected by this clinic that is transferred to another organization, and it auto fills up those areas because they use the same standards. So that is what we call structural interoperability. Semantic interoperability is a complicated one and refers to consistent clinical terminology and shared meanings. Once again, we'll take the example, my example, right? So that I set. So a patient is going to be discharged in a hospital and is about to go home into a nursing home. To achieve true semantic interoperability, systems must use identical standard terminologies so both systems can communicate with each other and exchange data seamlessly and populate data into the appropriate fields in the nursing home system. True semantic interoperability enables machine-to-machine data exchange. Lastly is the organizational interoperability, which refers to shared trust and consistency of policies and social and leading meanings to facilitate seamless workflows across organization. The organization should talk and meet in between. Policies should be tweaked in order to facilitate communication or data sharing, and a policy that hinders sharing, for example, should be modified. Consistently representing electronic health information across different stakeholders and systems with shared philosophies and social meanings is the bedrock of a successful organizational interoperability. Case Management Information System. So this kind of system will find resources, patterns, and variances in care to prevent expensive complications related to chronic conditions and to enhance the overall outcomes for patients with chronic diseases, according to McGonigal and Masrian. This kind of system analyzes data and look for trends in a client's patient's data. Once a trend is identified, the case management system provides suggestions as a decision support which promotes preventive care. A care plan is an example of an output of this system. In the place where I work, we have this kind of system too, and we just search for the patient's condition in the system and print out the care plan specific to that patient, and we don't have to create it by our own. This kind of system is beneficial for patient population with a high cost of care and complicated healthcare needs, for example, an older adult or patient with chronic conditions like diabetes, COPD, and many others. So the question is, where does these suggestions from the system came from? It came from the inputs of providers and nurses into the system. The more input, the higher the quality of the output or the care plan. This system is being integrated into the EHR. And the information that is collected in this case management information system is processed to reduce the risk, ensure quality, and decrease the cost, according to McGonigal and Mastrian. Another is communication systems. These systems promote interaction between providers and patients and among other healthcare providers that are designed to be HIPAA compliant. HIPAA is an abbreviation for um, Health Insurance Portability and Accountability Act. This is in the US. So this is a law in the US that protects patients' medical records, providing them with privacy. In Canada, we call it PIPEDA, or the Personal Information Protection and Electronic Document Act. In the Philippines, this is a very recent law passed. They call it the Data Privacy Act, or DPA, which is patterned after HIPAA and which is actually an equivalent to HIPAA. So before, communication systems are created separate from other systems, but now they are integrated into the designs of other types of systems. Example of communication systems are call light systems, wireless telephones, pagers, emails, and instant messaging. In the hospital where I work, we have secure chat integrated into the AHR of the patient. So hopefully soon they will work on a telephone too. So the benefits of integrating communications to clinical applications provides a real-time approach that allows interactions within the healthcare team and patients and their family. Next type of healthcare information system is the core business systems. Core business systems enhance administrative tasks within healthcare organizations, according to McGonigal and Misrian. Unlike clinical information system whose goal is to provide support for the patient in direct care. So when you hear the word clinical attached to a system, it means that it is in the bedside care, okay? So these are systems used to support bedside care. So unlike clinical information system, whose goal is to provide support for direct patient care, The core business system promotes administrative management of healthcare within an organization. There are four common core business systems. Number one is admission, discharge, and transfer, or ADT systems. This provides the backbone structure of other types of clinical and business systems, and when automated, will provide opportunities for health information exchange, leading to care coordination. The other type is a financial system. So these systems, this manage the expenses and revenue of providing healthcare. These systems are being used in the finance, auditing, and accounting departments within the organization. Final systems generate fiscal outcomes, which would give the management a forecast of the goals of an organization. This system shows the numbers in order to tell the future of the organization. What I mean by that is it tells if the organization is going bankrupt, saving, or gaining profits. Number three is acuity system. So the kind of system monitors the range of patients types within a healthcare organization using specific indicators. In the organization where I work, when patient visits the emergency, the pass they pass through a triage department as with any other emergency department in the entire world. So the triage system uses CTAS or the Canadian Triage and Acuity Scale. So there are 5 levels of CTAS. So level 1 means resuscitation. It is the highest acuity. So these are patients with absent vitals when they arrive, massively bleeding, or dying patients. Level 2 in CTAS is the emergent ones. So these are those having stroke or passed out or who is intoxicated. Level 3, urgent, those who have COPD, pancreatitis. Level 4 are non-urgent, or is it non-urgent? These are less urgent. So level 4 is less urgent, like those who have headache, dizziness, nausea, and vomiting. And level 5 is non-urgent, those who have toothache, non-complicated fracture, cuts, and minor wounds. By monitoring the patient's acuity, these systems provide feedback about how intensive the care requirement is for a patient. So for example, if you are a new nurse, so you are not assigned for patients with CETAS 1, right? Or 2 patients. Classifying and identifying patients' acuity promote better organizational management of expenses and resources necessary to provide quality care. They also provide an insight on staffing for safe care delivery. Scheduling systems. So these scheduling systems coordinate staff, services, equipment, and allocation of patient beds. This is usually integrated with other types of core business systems. It provides data to financial systems by monitoring staff and physical resources. Nowadays, hospitals are moving into adopting ERP or enterprise resource planning, which integrates many of the core business functions in one package. Now let's talk about order entry systems. So don't confuse this with the one that we discussed earlier, the electronic prescription. This one is the order entry system. These are used by physicians. So this is also known as computerized physician order entry system. It is a vital system in an organization, unlike clinical information system, whose goal is to provide support or direct patient care. According to McGonigal, this is used by physicians and sometimes nurses when they place orders instead of creating traditional handwritten transcription into paper. Order entry systems provide major safeguards which ensures that physicians' orders are legible and complete, therefore providing a level of patient safety that is not found in many manual systems. These systems also provide automated alert functionality and decision support. I already discussed this when we talk about the HR. Next is patient care support systems. These are focused to collect data and disseminating information related to direct care. So there are 4 most common encountered types of system used in healthcare. The first one is clinical documentation systems. So these are designed to collect patients' data in real time. They enhance care by putting data in the clinician's fingertips and enabling decision making where it needs to occur, which is at the bedside. The system is patient-centered, so they contain information that was found by the interdisciplinary team to be meaningful to the patient. Example, vital signs, notes, and etc. In the place where I work, we bring the rover with us, the iPhone XR, and we enter vital signs as we are getting it. So, and then it cross-reference, create trends, and give you information right at the bedside. Number two is pharmacy information systems. So from the word pharmacy, these are used by pharmacists to order, manage, and dispense medications for a facility. They also incorporate information for allergy, height, and weight to ensure effective medication management. Number three is laboratory information systems. This is one of the most clinical information ever used in healthcare. The system report blood, body fluid, and tissue samples along with biological specimen collected at the bedside and received in a central laboratory. Number four is radiology information systems. These systems schedule, provide results, and store information related to the diagnostics radiology procedures. An example of this is the PACS. It is also common in the Philippines. When I was there, PACS were there, or the picture archiving and communications system. So we move on to the last category, which is the application of health informatics in education. So I know you guys are familiar with this. So according to my favorite source, McGonigal-Mistrian, 2021, e-learning is synonymous with online learning and web-based education. They caused a significant shift in student-teacher relationship in nursing education. Nursing students also expects to make use of wide ranges of cutting-edge technology during their learning. E-learning is no longer limited to the domain of the classroom, laboratory, or even patient's bedside. It allows educator to translate theory into practice by creating a virtual classroom space that promotes collaboration like what we are doing. It promotes collaboration, promotes engagement, discussion, and analysis. On your slide are examples of social media that can be used in education. So some of these are familiar to you and some of these are not. The ones that are familiar to me are Flickr, Instagram, Pinterest, Prezi, SlideShare, YouTube, and that's all. And the rest you can go and try if they can be used for e-learning. Next slide is teleconferencing. So teleconferencing is meeting through a telecommunications medium. It is a generic term for linking people between two or more locations by electronics. There are at least 6 types of teleconferencing: audio, audiographic, computer, video, business televisions or BTV, and distance education. This is a video from YouTube by Livestorm that talks about a webinar. I know you guys know I'm very familiar with what webinar is. So a webinar is an online event that is hosted by an organization or company and broadcast to a select group of individuals through their computers via the internet. The webinar is also very famous in nursing because a lot of our seminars are being transmitted through a webinar. The next video is a video from Livestorm, which will give us an idea on what a webinar is and what not to do in a webinar. Let's watch this.
Did you know that webinars have been around since the early 90s?
Oh, I can't believe it. I can't believe that webinars are there since early 90s. I just learned internet when I was, I think, third year college. No, not third year, third year high school. 1990 is like when before elementary.
No? Well, me neither. But regardless, webinars are now completely different compared to what they used to be, especially since 2020, where online video communication has really taken off. And with the ban of many in-person gatherings, webinars have been the go-to. Now, many people use them to stay connected, to interact, and to collaborate in many new and different ways.
As I've said, in nursing, we use this for training purposes. This is from Livestorm.
Hey guys, I'm Daniela, Content Manager at Livestorm, and today I'm going to explain what exactly a webinar is and how they work. So first things first, what is a webinar? Well, the word webinar actually stems from the combination of the words web and seminar. In a nutshell, it's an online video presentation that can either be done live or recorded ahead of time. And one thing you should know is that webinars can be used for all kinds of things, but typically there's always a main element of training or teaching that's involved. And to give you a few examples, they're great for hosting online events, for onboarding new clients or employees, for sharing information about a new product, and the list goes on and on. Now you might ask yourself, do I need a webinar platform to host my webinar? Well, technically speaking, no. It's definitely possible to host a webinar on YouTube or even Facebook Live. But there's a few crucial things that you'd be missing out on. What's great about using a dedicated platform is you can have personalized registration pages with details and great visuals to really promote your webinar. And you can also set up automated emails, including reminder emails for everyone who signs up. Also, with a webinar platform, you have access to all engagement features like chats, Q&As, and live polls.
And that's the advantage of using a webinar platform instead of like doing it in Facebook Live or YouTube Live or Instagram Live. The webinar platform can offer you a lot of controls like muting people or muting participants or asking polls during your session. And also, what else? There's a lot of things that you can do. Registration, and only those who registered can enter into your webinar. So that's an advantage. Doing it in Facebook Live and YouTube Live, it's open to everyone. And for me, it loses its value. Okay, let's continue watching.
What's great about this is it's one of the few ways in which you can really interact and collect valuable insights from your audience at scale and in real time. And finally, you have all the analytics. So you can see how many people signed up versus how many people actually attended, how long your audience tuned in for, and approximately what time they started to sign off, and so much more. And all of this valuable data gives you the clues on how you can optimize your presentation for next time. Okay, I've talked about what a webinar is, as well as what's possible with a dedicated platform. Now let's focus on the logistics and the presentation itself. So there's typically several people involved when running a webinar, because having one person to present while simultaneously answer messages and questions and even launch that little poll on the side is virtually impossible. I've actually made that mistake one time and I was completely overwhelmed. So I don't recommend making your webinar a one-person show unless it's a really simple presentation and you're expecting a really small audience. So first of all,
Okay, so very important. She said if you have a webinar, you should have a team. Don't do it alone because you'll be flustered with a lot of, like for example, technical issues and features, and sometimes you cannot talk and operate at the same time. So you need people to help you with this. This is a not a one-man show. Unlike so people who are born before 1980s would think that, oh, computer stuffs are easy, webinar is easy, you just have to click it once. I've attended a webinar before where this is a one-man show, and everything is disorganized. The sound, the music, no one's operating it, no one's monitoring it, and it's just crazy.
There's always a main presenter of a webinar. And depending on what kind of webinar it is, there might also be a guest speaker, like a relevant industry expert, which, by the way, is always a great idea in terms of adding credibility to your topic and getting you more exposure for your event. And second of all, it's good to have a moderator to help run the actual webinar. So this person acts as kind of a behind-the-scenes helper that can help interact with the audience so that the host and other guest speakers can really focus on the presentation itself. And finally, let's talk about what the actual webinar presentation looks like. You might be wondering this if you've never attended one yourself. So think of it as an in-person presentation, but just online. So most presentations are in the form of PowerPoint slides, but often include videos, web pages, and other multimedia content. And the same exact goes for webinars. The main difference, and one thing to keep in mind, is that with online presentations, it can be a little trickier to keep your audience engaged, especially as you can't see them. There's no eye contact. And that's why spicing up the presentation with content and visuals to make it more interesting is really important. And it's great.
Yeah, so if you're doing webinars and you really have to attract the attention of people, 30 minutes is the attention span of people. My video right now is more than an hour, and I hope you guys are not sleepy, and I hope this one will not make sleepy when listening to this one. And actually, this is the bulk of the nursing informatics. So you guys have to listen to this presentation.
To set up little breaks throughout the session so that you can interact with the audience. For example, with a poll or even a little Q&A. And you also don't want to keep your presentation too long. What you'll notice is that people will start signing off after a certain point. And while there's no set rule here, it's best to keep your presentation between 30 minutes to an hour long. You want it to be long enough to communicate your main points and also save a little time at the end so that you can take some questions from the audience. All right, I've covered what a webinar is, how it works, the logistics, and the presentation. I think that covers it for this video. I hope that you found it helpful and informative, and that it inspires you to get out there and to start planning your own webinar. Don't forget to subscribe.
And that's all about webinar. And I think I'm done with my presentation for today.
Did you know
Just a gentle reminder, please submit your website critique assignment, which is due for this week, and midterm is around the corner. So just an advance announcement. I'll be what do you call it? I will send a reset to all the passwords in class marker, because the last time it was a good lesson for me that almost only a lot of you are asking for the password in class marker, and I don't want it to happen again, to like individually reset your password. So for at this time, I'm gonna reset all your password close to the midterm date, so everybody can change their password and they don't have to contact me for their password. So your reset link will be sent to your email, and from there you can click the email and click the link and then reset your password. Okay, 2 new reminders: website critique assignment and your midterm is around the corner. So these are my references. If it's very small, I would like to put this one as a Word attachment to my presentation today, and these are my references, and you can always read all those references that I have. And for people who have books, who have this book, the Nursing, Informatics, and the Foundation of Knowledge, the chapter that we are discussing for today is chapter 10 and chapter 14 of this book. Okay, so please read those. It's very important and it will be included in your midterm exam. If you have questions, please write down your questions in the class comment below, and I will reply to your questions as fast as I can. So I think that ends my discussion for this week. I thank you for listening, and always, if you have any concerns, please don't hesitate to contact me. Thank you so much, and have a wonderful day, all of you.